everyone, my name is Claire Smith. I'm the physician assistant at Progressive Pediatrics, and I wanted to talk with you guys about sudden infant death syndrome today. So sudden infant death syndrome, a lot of people just say SIDS, is an uncommon but very scary thing. About 3,500 infants a year die of this in the US. And it is very preventable if we just take a couple of precautions. So the first thing I want to talk with you guys about are the SIDS guidelines. So the SIDS guidelines were put into place to hopefully decrease significantly the amount of SIDS deaths each year. The first and most important one is to always put your baby on their back to sleep. This should be also on a firm sleep surface with nothing else in the crib or the bassinet. So I'm talking no stuffed animals, no pillows, no sheets. If you are worried that your baby might be cold, you can use one of those infant sleepers, like a infant swaddler if your baby is under 2 months of life, or you can do one of those sleep sacks. Because it needs to be flat and firm, there are a couple of products on the market now that are notably not this. So the Rock and Play and Swings are not safe sleep surfaces for your baby. Now, some people get concerned. They think what happens if the baby spits up? And I want to just reassure you that the baby's anatomy and also their gag reflex will make it so that this regurgitation is not harmful for them. The more harmful thing is actually the risk of SIDS by putting them on their belly. Some people also consider doing a side lay as kind of a compromise for this fear that they have. So the side lay position is also not safe because that actually makes it easy for the baby to roll over onto their belly before they know how to do it. Now, if a baby is placed on their back and then they themselves roll over onto their bellies, don't worry about that. You don't have to be checking your baby throughout the night to make sure that they didn't roll over onto their belly. If they do it by themselves and they were placed flat on their back, that's totally fine. They also recommend room sharing, and some people believe that room sharing decreases the risk of SIDS because it helps keep the baby out of that really deep sleep where sometimes babies can run into issues. So they recommend sharing a room with your baby from 6 to 12 months of life. And now this is not bed sharing, it's room sharing. You should never share a sleep surface with your baby. So never fall asleep with your baby in the bed or on the couch. Bed sharing has higher risk if a couple of things are true about you and your baby situation. So it's a higher risk of SIDS if your baby is 4 months or under, if mom smoked when she was pregnant, or if there was any smoke in the house or right outside the house, if you have been using alcohol that evening or are on any other medications that would make it harder for you to be woken up. Also, if there are things like a duvet cover on the bed or any kind of soft fluffy things that could kind of get in front of your baby's airway and make it harder for them to breathe. Also, if your baby was born prematurely. The swaddling, I want to go back to that. So swaddling is completely safe to use, a swaddler or just a regular kind of swaddling blanket around your baby up until 8 weeks of life, but please do stop swaddling after 8 weeks of life because babies actually at that age have been known to turn over for the first time. And if your baby is swaddled when they turn over for the first time, they might get into a difficult situation breathing wise, and they won't be able to use their hands to push their mouth and their airway out of that dangerous situation. A tip to decrease incidence of SIDS also is to offer a pacifier. So a pacifier can be used at any time in a baby that's bottle fed. If you are breastfeeding your baby, the recommendation is to wait at least 2 to 3 weeks until breastfeeding is well established before you offer the pacifier. If you offer the pacifier and the baby spits it out, don't continue to try to, put it back in there. You just leave it alone. And if the baby falls asleep and the pacifier falls out of their mouth, same thing, just leave it alone. Breastfed babies do have a lower risk of SIDS, so that's another benefit of breastfeeding. Also, vaccinating your baby has been shown to reduce the risk of SIDS. And it's also important to make sure that your baby has good tummy time every day, so about an hour a day, because when you have your baby lay on their back, when they're sleeping, you run the risk of having the flat head syndrome. So we want to try to avoid that and make sure that their necks and their heads are nice and round and their necks are nice and strong. If you have any questions about the SIDS guidelines, please do call me at the office number, and I'll see you in the office soon. Bye.